Kidney infections, symptoms and treatment. Kidney infections or pyelonephritis can occur when bacteria from the urinary tract travel up the urethra and affect one or both kidneys. Most of the time, the bacteria that cause kidney or renal infections come from another part of the urinary tract, such as the bladder, ureters, and urethra. Kidney infections most commonly affect people who already have a bladder infection, females, and pregnant people. People who experience the symptoms of a kidney infection should seek medical attention as soon as possible, as the condition may cause permanent kidney damage or spread to other parts of the body. This video will explain the symptoms of kidney infection and how doctors diagnose and treat it. Signs and symptoms. People usually develop kidney infections quickly, within a day or a few hours. Kidney infection symptoms include diarrhea, nausea and vomiting, chills or shivering, lower back pain, pain in the groin, pain in the side, fever. If there is a corresponding urinary tract infection, the individual may experience pain or difficulty while urinating. This may feel like a burning or stinging sensation. Other symptoms can include bloody urine, cloudy urine, foul-smelling urine, frequent urination, inability to fully empty the bladder, pain in the lower abdomen, confusion. Males versus females. Males and females will have similar symptoms if they have a kidney infection. Females are more likely to contract a kidney infection. A female's urethra is typically shorter than that of a male. A female's vagina and anus are also closer to the urethra. This can make it easier for bacteria to enter the body via the urinary tract. Pregnant females are also more likely to develop a urinary tract infection or kidney infection. A male under 65 years of age presenting with a urinary tract infection is likely to have the possibility of other conditions ruled out first. Doctors may check the person for other types of infection and for signs of a urinary tract infection. Causes. A kidney infection happens due to bacteria or viruses entering the urethra and reproducing in the bladder, triggering an infection. Most of the time, a kidney infection is the result of a bladder infection that travels to the kidneys. An infection may happen because of transference from bowel to genitals during sexual intercourse, accidentally transferring feces to the urethra while wiping with toilet paper after a bowel movement, contracting a urinary tract infection. Risk factors of kidney infection include kidney stones, having a urinary catheter, an enlarged prostate in males, having a urinary tract shaped in a way where urine may not pass through easily, having vesicoureteral reflux, where the urinary tract allows urine to flow back up into the ureters, pregnancy, diabetes, a weakened immune system because of medication or a medical condition, a spinal cord injury or nerve damage that could block symptoms of a bladder infection. Treatment. A person with a suspected kidney infection will have their urine tested. The usual course of treatment for a kidney infection is antibiotics, though some people require other forms of treatment. Antibiotics. If a person's symptoms suggest an infection, A healthcare professional will prescribe antibiotics before the test results return. A person may also take pain relief. When taking antibiotics, a person must finish the whole course of medicine. When test results return, a medical professional may change the antibiotic to one that will more effectively treat the infection. Fluids. A person with a kidney infection should consume plenty of fluids to help prevent fever and dehydration. Fluid intake recommendations may vary depending on the type of infection. Hospital treatment. A person whose symptoms are not improving or who has more severe symptoms may require treatment in hospital. A person may have antibiotics administered intravenously through a vein in their arm. If a person experiences dehydration, they may have fluids administered with a drip. Most cases of hospitalization do not last more than 3 to 7 days. Surgery. A person who has a kidney stone or enlarged prostate that is blocking their urinary tract may require treatment through surgery. Prevention. Often, a kidney infection is the result of a pre-existing infection in the urinary tract. The best way to help prevent a kidney infection is by taking steps to help avoid an infection in the urethra or bladder. Some tips around factors that can help prevent a kidney infection include the following. Hydration. Drink plenty of fluids, particularly water. Urination. Urinate whenever there is an urge. Do not wait. Sexual intercourse. Urinate after sexual intercourse. Wash the genitals before and after intercourse. Hygiene. Wash the genitals every day. Do not use deodorant sprays on the genitals. Toilet hygiene. After passing stools, wipe the anus from the front to back. This reduces the risk of spreading bacteria to the genitals. Fiber. Eat plenty of fiber so that stools come out easily and do not cause irritation or skin lesions. Constipation increases the risk of developing a kidney infection, and a lack of fiber has links with kidney stones. When to contact a doctor. If a person does not seek medical advice, they could develop serious complications. Contact a medical professional if a person is experiencing persistent pain in the mid to low back or side, feeling shivery or has a fever, experiencing nausea or generally feeling unwell. A kidney infection can be the result of a number of conditions, the most common of which is a urinary tract infection. Females of all ages and males over 65 years are more likely to contract a kidney infection. Most kidney infections will resolve themselves with plenty of fluids, preferably water, and a short course of antibiotics. Some people may require additional treatment. A person should consult with a medical professional if they suspect a kidney infection. Some infections can lead to more serious conditions that may require hospital treatment. A person can reduce their chances of contracting a kidney infection through maintaining good hygiene and good toilet habits after passing stools, wiping front to back after passing stools, urinating and washing the genitals after sexual intercourse,